So next, we're going to prioritize hypotheses or figure out where do I start? And they might ask, what is the client most likely experiencing, at risk for, or what should I do first? And when I'm trying to prioritize actions, patients, or anything, I kind of like to ask myself this question: if I can only do one thing and walk away, or see one patient and ignore the rest, who is it, or what action am I going to do? And so let's figure out how they want us to prioritize hypotheses here. So now in this case, we're being asked, the nurse should first address the client's nausea, leukocytosis, which is the high white blood cell count, hyperglycemia, or fluid volume deficit, followed by which of those? So we need to pick our top two. Which one do we want to address first? Which one do we want to address second? And then after we start to treat it, what do we expect their potassium level to do? To increase, decrease, or stay the same? Do you guys remember, for prioritization, what do we want to prioritize for this patient? Remember, we've got two things going on, two big things going on, and that is we have our DKA, which is acidosis and dehydration, and the source of all of these is that we can't really get glucose into the cells. And you guys are, fluid deficit, fluid volume deficit. And I agree, because that, although it's not the primary problem here, it is the priority problem. That is an issue of circulation. It kind of doesn't matter what my blood sugar is if I don't have enough circulating blood volume to perfuse my brain, my kidneys, my tissues. That is an emergency. So yes, we are going to first address their fluid volume deficit. And then you guys said hyperglycemia first. And I agree, hyperglycemia, because remember, that is kind of the root of what's causing this dehydration problem. And how would I fix it? How would I address, you guys said fluids, to give fluids. How would I address their hyperglycemia? There's a medication I'm going to give. I've got two meds I'm going to give to correct this. First, fluids, like you guys said, to address the fluid volume deficit. And then, Audrey Marie says the client's dehydrated. The nurse should give fluids for the deficit. Hope's getting ahead. Cadena says give bolus of fluid with an insulin drip. Yes, exactly. So we are going to give continuous IV insulin for DKA. And when we give insulin, what is the potassium going to do? And Hope said the K will go lower. eReview says if I had said hyperglycemia first, then fluid volume deficit, would I get it wrong? Yes. The idea is that you're prioritizing in this step. In step 3, you are picking what do I do first and second. And so if you'd said hyperglycemia followed by their fluid deficit, then you would be delaying addressing the circulation issue, and that'd be putting your patient at risk. And everyone is saying decrease the potassium, and that is right. And that's really, really important to remember. So we got this correct. That's really important to remember because low potassium can cause those dangerous dysrhythmias. So basically, insulin is responsible not only for carrying glucose into the cells, but also carrying potassium into the cells. And so when you've got really, really high hydrogen ions or acidic blood, your cells try to balance this by just pulling in, kind of collecting and storing away as many hydrogen ions as they can to pull them out of the bloodstream and try to kind of buffer that really, really low pH. And then we give insulin, and then the potassium is going to shift into the cells. So that's why we tend to see high potassium before we treat in DKA and then low potassium afterward, because we've pushed it into the cells. So that's something important to anticipate. Very good.